Pike, and I am a board certified veterinary behaviorist in the Washington, D.C. area. Today, we're going to be talking about low stress handling for husbandry at home. So just a few housekeeping items. First of all, I'd like to thank Your Dog's Friend for sponsoring this lecture today, and for they're going to be putting this lecture up on their YouTube channel as well as their website. So in case you miss anything or you want to go back and look at some of the videos that I have, you're welcome to do so. So I will be answering questions at the end of the talk. Please use the chat function on your end to ask your questions. The moderators, Deborah and Nicole, may actually answer some of your questions along the way if they're able to. Otherwise, I will be answering those at the end. Please limit your questions to the specific presentation. And if you have any specific questions about a pet or patient's care, please email me. And my email information will be at the end of the talk. So with that, we're going to start with low stress handling for husbandry at home. In other words, your veterinarian says you need to clean your dog's ears twice a day, then apply this medication for the next 14 days. And in your mind, you're going, seriously, how am I supposed to do this? Because your dog is like this. So how do we handle this? Well, in order to help you with these issues, we must first understand a little bit about learning theory. So I'm just going to go over the basics that you need to understand the rest of the presentation. So don't worry, I'm going to go over everything that you need to know. Let's talk about what the 4 stages of learning are. And this is for any animal, whether it be a human or a dog. So the first thing is acquisition. This is where we're acquiring new knowledge. The learner learns the expectations or whatever are expected of them during the learning process. And the focus is on the accuracy of the response. The next thing is fluency. This is where we make it automatic. We enhance the speed of the response. This is, in essence, like learning your times tables. So you can automatically say 6 times 7 is 42, and it's just rote memorization for you. The next phase is generalization. So we're going to make that relevant into a variety of different situations. So different times, different locations, in different orders of operation. And then the next one is maintenance. So it just becomes a part of your behavioral repertoire. Let's talk a little bit about some terminology that you'll need to know. The first is conditioning, and all conditioning means is learning. The next thing is behavior, and a behavior is just a response. The stimulus or the trigger is an event that's perceived by the learner. And the consequence is basically the action or event that happens after the behavior is performed. So how do animals learn? Well, there's several different ways. The first one is habituation. Basically, this means your ability to stop reacting to meaningless stimuli or triggers. And this is oftentimes a very weak stimulus or trigger. So I equate it to, I went to undergraduate in northern Arizona, and there was a railroad track running right through the town. And when I first moved into my dorm, I heard the train go all night long. But after about a week, I didn't even notice it. So I habituated to that noise. And so animals can habituate to different stimuli as well. Then there's sort of the opposite, which is sensitization. So sensitization is where the reaction actually becomes even stronger. It's the opposite of habituation, and this is most frequently with an intense stimulus. So I, have the little picture of our St. Louis Arch. That's where I did my residency in behavior. We have horrible thunderstorms there, and oftentimes the animals and the people would sensitize and become phobic of those storms. So the intensity level, though, is up to the learner. So what's intense to one animal may not be intense to another. So there's classical conditioning. So this is oftentimes known as Pavlovian conditioning because of Pavlov's experiment. It's also known as associative learning. So how this works, and this is kind of a complicated slide, basically to just say we have this unconditioned stimulus, which in Pavlov's experiment was food, which causes a reflex in the learner and leads to an unconditioned response. So reflexes are automatic. You don't have to think about it. And in an animal, the dog, it would salivate because it's presented with food, because you have to get that saliva going in order to break down your food. So then you pair that with a neutral stimulus. So the neutral stimulus being like a bell that doesn't in and of itself cause a response. So the dog hears the bell and nothing happens. But during conditioning, we're going to pair that bell followed by the unconditioned stimulus, which is the food, which automatically elicits that unconditioned response of salivation. And after conditioning, that stimulus, that conditioned stimulus, elicits automatically that conditioned response of salivation, even without the food. So you take out that, that stimulus. All right. Then there's desensitization and classical counter conditioning. So desensitization means exposing the animal at a level, and this is the picture at the left, exposing the animal at a level where it doesn't react and they're relaxed and able to learn that that thing isn't so scary. Classical counter conditioning is often paired with desensitization. So we're using something like food, which is positive for the animal, repeating that desensitization under threshold and creating a relaxed or happy animal because it's associated with food. So let's say the dog is fearful of other dogs. It sees another dog at a level in which it's not reacting. You pair that with the food, which is a good thing for the dog. The dog then realizes that presence of other dog means good things. Therefore, I'm going to be relaxed or happy when I see another dog. Now, desensitization and sensitization really run a fine line. You can sensitize a patient in an attempt to, or a pet, in an attempt to desensitize them. So we have to be very, very careful when we're using these modalities, these training modalities, that we are always keeping the animal under threshold, because otherwise we could actually make the trigger worse for them. What is simultaneous conditioning? Simultaneous conditioning is a process where the conditioned stimulus, so like the food, and the unconditioned stimulus, let's say a bath, which we're going to be talking about husbandry stuff today, are basically presented at the same time. So instead of following the bath with a treat, the treat is happening the entire time the animal's getting bathed. So this is not necessarily the strongest or best way to learn, but it's sometimes the easiest to accomplish in real life. And this is especially true in the veterinary setting. So we will oftentimes smear some peanut butter or easy cheese on the table, the exam table, while the animal is getting their vaccines and their physical exam. So they are focused on eating the whole time, and I'm just doing what I need to do. So I'm distracting them, but I'm also performing simultaneous conditioning. So this is an example of simultaneous conditioning. This is my little dog Scooby getting a bath in the sink, and I have just smeared some peanut butter on the edge of the counter, and he is able to lick that the entire time that he is getting a bath. So operant conditioning is different in the fact that we are going to actually have the animal operate on their environment, which is why it's called operant. Often known as instrumental learning or Skinnerian conditioning, because B.F. Skinner was kind of the first person to really develop this terminology and use this to his advantage. He did it in a lot of rodent models, hence our little rat here that says, "We'll press lever for food." Basically, a behavior or an action has consequences. Some people like to think about it as the ABC. So the antecedent, which is the environmental setup, leads to a behavior. The performance of a response leads to a consequence, and that consequence is going to determine whether the animal increases that behavior in the future, or the performance of it, or decreases it. So let's talk about kind of the quadrants of operant conditioning in a bit, but first let me talk really quickly about flooding. Flooding is essentially prolonged exposure therapy. So if you think about some sort of fear that you may have, mine personally is spiders. And if I'm scared of spiders, you're going to put me in a room filled with spiders until I basically don't worry about them anymore. So you're not going to feed me food or pay me $1 million, while I'm being exposed to these spiders. You're basically just going to wait until I stop responding. So unfortunately, this is considered inhumane. I would consider it inhumane if I was in a room full of spiders, for sure. And this can often lead to worsening or sensitization. So we definitely don't want to do this. The other thing that it can lead to is learned helplessness. So learned helplessness is essentially where the learner reaches a state where they become passive and non-responsive because they feel like there's no other option like escaping or fighting. So basically the learner says, I guess I have to put up with this because I have no other recourse. This oftentimes happens in the veterinary setting. As a veterinarian, many times we take our patients into the back for various things, whether I need to draw blood or take an x-ray, and I can't have my clients come back there. Oftentimes our patients will, quote, do better in the back because they shut down. They basically give up trying to avoid me. They give up trying to fight me, give up trying to flee away from me, and they merely shut down and take it. So while they do better from a veterinary standpoint in terms of I'm able to get my job done, that doesn't mean that they are less fearful. And in fact, they probably are even more fearful than they would be in the presence of their owner. So this is a really common scenario that we want to avoid in a clinical setting. Let's talk about some factors that affect learning. The first is deprivation level. So if you have just eaten Thanksgiving meal and someone says, you can clean toilets in my house, but I'll give you some cheesecake, you're probably not going to want to clean toilets in the house, right? Because you're full, and so who cares? But if you have not eaten for 3 days, and of course I'm not advocating this in our pets that we not feed them for 3 days before training, but just to give you an example, if you haven't eaten in 3 days and somebody offers you a steak to clean toilets, heck yeah, I'm going to clean those toilets, right? So deprivation level is important. One of the things that we do in a clinical setting is we oftentimes will fast our patients before they come in for training, because it does make them more apt to take treats, especially in a stressful environment that is a veterinary clinic. But also the reward amount and quality of that reward. So I would not clean toilets for $1, but I may clean toilets for $1 million, right? In fact, I'm definitely going to clean toilets for $1 million. So when we talk about, you know, the animal isn't treat motivated, maybe we just haven't found the high value treats that they're willing to work for. And that's different for every patient. So or every pet. I saw a case yesterday of a dog who would only work for Teddy Grahams, which I thought was the most fascinating thing. And the owners discovered it because they were eating s'mores one night and the dog loved graham crackers. And so they realized Teddy Grahams actually would make a really good treat for that dog. But I tried to give it some peanut butter, some easy cheese, forget it, didn't want it, but it worked for Teddy Grahams. So for every animal, it's very different. And then the overall arousal level. So if you are highly aroused or stressed out, you are not going to be able to learn. So you must be under threshold in order to actually perform behaviors, especially ones that are difficult to perform. So making sure that the animal isn't aroused. I love this graphic by Yaletown Dog Training that shows the concept of keeping your patients and pets under threshold. This is called trigger stacking. So trigger stacking means basically above a threshold, a behavior could happen, but below it's not going to. So this particular graphic shows, you know, let's say the animal is stressed about large dogs, and there's some large dogs present. And then a person goes and pets it on the head, and they're stressed about that. Then a little kid goes by on a skateboard. Well, if each one of those things happened individually, they're fine because they're under threshold. But if somebody reaches for it and pets it, and they also have a dog next to them, and then lo and behold, a little kid goes by on a skateboard, that dog is over threshold and it could actually bite in that situation. So we always want to maintain our pets and our patients under threshold because we don't want to push them over that. All right, so let's talk about a start button behavior. So a start button behavior is essentially a way to determine if your pet or your patient is consenting to the interaction. So two of the most common start button behaviors that we use in practice are the chin rest behavior and a mat behavior. So I'm going to show you some videos of these. This one is my nurse, Jessie, working with Sergeant Daisy May, and yes, that is her full name, on her mat behavior. And Daisy May does have handling issues at the veterinary clinic. So Jessie is working with her to get her comfortable with handling. And Daisy May's treat of choice is baby food. So Jessie's got a jar of baby food there. So she's not cueing her to do anything. She's just letting Daisy explore. And she's going to wait until Daisy says, okay, I'm ready to work. And so she just rewarded her for having all 4 paws on the mat with a lick of baby food. Now she's going to up the criteria just a little bit and wait for her to do a down. And so she rewards her for laying down. And so that is Daisy's start button behavior. And it's fascinating to me. Daisy is a long-term patient and she comes in quite frequently. Every single time she comes in, she runs to the mat and lays down. So she knows she's ready to work and she's telling me everything is okay. This is Jessie with her own dog, Dell, teaching her a down on a mat. And she is allowing her to shape the behavior herself. She rewards her off the mat so that she can reset her and tell her basically, if you want to do it again, come back. And you can see she's choosing to come back. This is my own dog, Pike. His whole name is Dwight D. Eisenschnauzer. He is a 3-year-old giant schnauzer who has major handling issues. And so we have worked a lot on our start button behavior as well as desensitization and counter conditioning to husbandry stuff at home. So he's going to play a featured role through this whole presentation. So show you his mat behavior. He gets very excited when his mat comes out and we cannot get the mat down fast enough. He also likes to arrange it himself, you can see. So I'm just getting his mat out. He knows that that means we're ready to work. And you can see how excited he was with his little butt wag there. So he oftentimes has difficulty putting his whole body on the mat. So I try and reposition him a little bit with a hand target, which he thinks I'm trying to do a chin rest there. But that gets him on his mat and ready to work. All right, let's look at a chin rest behavior in Ike. So he is laying his head into my hand for a chin rest, which allows him to kind of station for certain behaviors that we need him to do. So we'll go over some ear stuff in a bit. So one of the things, we've got our start and button behavior, but the other thing that we need to keep in mind with many of these animals is that they may use aggression as a behavioral strategy because some of the things that we have to do for them are stressful and scary. And so we want to make sure that we're keeping safety in mind. So one of the best things to do is to train the animal to wear a basket muzzle. So I think every dog should be trained to wear a basket muzzle from the time they are puppies. We train it in our puppy classes because you just never know when you might need it. Maybe the animal steps on a piece of glass and you as an owner need to pick that piece of glass out of their paw. Guess what? That's painful. They could bite you. And so if we have an animal that is basket muzzle trained, they're comfortable wearing it, and it's actually a good thing for them, then we have a safety tool in place. The other thing is towel wraps. We use a lot of towel wraps in a veterinary setting, especially for cats and small dogs, to basically just restrain them, but in a very comfortable and safe way. Minimal restraint is the best. So it is actually also the safest. So if you've ever heard of the concept of fear-free, which we'll talk about at the end of the presentation, our whole goal is to have as little restraint as possible, because oftentimes it's the restraint that is the scariest for the pet. Because if I can't flee because you are holding me tight, that means I only have the only recourse is to fight. And so that actually leads us to make sure that to be the safest with these animals, they actually need the least amount of restraint, which seems counterintuitive for a lot of us who have been in the veterinary field for a long time. And then we also need to be able to pick some of these patients up. So if I have a little dog, I need to be able to get them into a bathtub or to get them into the sink to give them a bath. I need to be able to pick them up and get them into a vehicle, pick them up, get them onto a veterinary exam table. But many of these animals have difficulty with picking up. So we'll talk about how to do that in a second. So basket muzzles, like I said, we are big proponents for. My favorite ones are the Baskervilles and the Italian basket muzzles at the top here. So the black Baskerville muzzle and then the Italian brown one that you see here, because they allow the best fit for most patients. So the Baskervilles work great on kind of your shorter snouted dogs like pit bulls, labs. Oh, you can hear Pike yelling in the background in my house. That's so lovely. And then the Italian basket muzzles actually work great for longer nosed dogs. So those are the two styles that we typically use. There are custom made muzzles. You can find shops on Etsy that make custom biothane muzzles. But we don't recommend using either this mesh one for a couple reasons. Number one, you can't get any treats into it through the front because it's completely covering the mouth. And then these typical cloth ones that we use in a veterinary setting, I don't recommend those either, because in order to work, they have to keep the dog's mouth completely closed, which means they can't pant, which can be very stressful for an animal, because panting is not only a stress reliever, but it's how they dissipate heat from their body. So they have to be able to do it functionally. So for those cloth muzzles to work, they should only really be on for maybe 2 to 3 minutes at a time at the most. Whereas our basket muzzles, once they're trained, they can wear those for hours on end as long as they're comfortable in them, because they can pant, they can drink, so they can stick their whole face with the muzzle into the bowl of water and lap up water. They can, I've even seen dogs learn how to get kibble through the holes and actually eat their meals through it. So really, really nice tool. I have a video here of Brittany Thomas, who was my technician when I practiced in Kentucky, and she is teaching her dog Harlan through shaping how to put his face in the muzzle. So I always tell owners that I want them putting the muzzle on, not you putting the muzzle on them. So I want this dog to shove his face right on in that muzzle, right? So couple things just to kind of point out to you. Number one, Harlan is obviously very excited to shove his face right on back in there. Brittany is treating him away from the muzzle, so he has the opportunity to leave if he wants to. The other thing you'll notice is when Brittany goes to do the straps, Harlan's tail stops wagging. And so I would say he is actually not 100% comfortable with the straps yet. So I probably wouldn't have pushed him that far, but this is one of the reasons we all as trainers video our training, because we can go back and actually watch it and see what mistakes did we potentially make. How far did we push it too far? Was there something that we should have looked at body language wise, etc. So. All right, so this is an example of a towel wrap, and this is from Dr. Sophia Yin's low stress handling course. So this is a great way to be able to handle a small dog or a cat if we need to do nail trimming, if we need to clean ears, do eye drops, as long as the cat or the dog is comfortable with it. So this is definitely something that has to be, worked with the animal. Although in a pinch in a veterinary setting, we can absolutely use these as well. So you can see she's made this little, we call this the kitty burrito. So she's pulling the flap of the towel up and then pulling it forward to make a little flap there. And then up and around the neck as a good restrainer. And then she's going to do the exact same thing with the other side of the towel. And then you can get limbs out at a time. You can also, do your ear cleaning, your eye drops, all that kind of fun stuff. All right, so we have to set up the environment for success for these animals. So we need to make sure that we've got everything ready in order to do our training. So we talked about having those treats for Ike. These are his favorites. He likes turkey hot dogs, deli turkey, and cheese, whatever cheese we have on hand. On the right hand side, you can actually see I'm wearing a clicker ring. So this is, the clicker is just a marker. So it tells the learner that is the exact behavior that I wanted from you, and that's what I'm rewarding. So because we are fairly slow as humans, by the time I get my treat out of my treat pouch and hand it to my dog, their brains have already moved 6 and 7 steps ahead. So the clicker allows us to tell the animal, Yes, that is the very moment that behavior happened, and that's why I'm about to reward you. Okay, so that's the nice thing about marker training. You don't have to use a clicker. You can use a marker word like the word yes, or some trainers will do a mouth click. I'm not very good at the mouth click, so I don't do that, but I love this clicker ring because it kind of frees up my hands a little bit as well. So you've got your clicker, you may need your towel for your towel wraps, you may need your towel for your bath, but also you could use a towel as a mat. You want to make sure that you have all your products ready to go. So if you need your towel, if you've got your Adaptil spray for some pheromones there, have everything ready before you actually get the animal involved. These are just some setups that I have seen or used in the past for bath time. So the picture on the left is actually our clinic. We have a stand-in tub for the dogs, and this is a really common grooming tub. The dogs can actually walk up the ramp themselves, so I don't have to actually pick them up and get them in. We teach them to walk up the ramp. We can use a lure, a little treat line to get them up and in there, but basically I don't have to pick them up, and that's especially important for dogs with handling issues, but also a 90-pound giant schnauzer. The picture in the middle is a veterinary colleague of mine, and you can see that they have put a non-slip yoga mat in the middle of the shower with the drain hole cut out so that the water can drain. They've also got their products ready. They have a tennis ball, which is their dog's favorite thing, as well as a little licky toy here that's suction cupped to the wall so that they can smear peanut butter or easy cheese or something on it to do some simultaneous conditioning. This is Scooby. This is our shower setup at home. I will just put a towel down on the shower floor because it's going to get wet anyway, and I'm just going to toss it in the laundry. But this is the easiest way so that the dog and myself are not slipping and sliding. And a walk-in shower obviously is quite nice for this because the human can get in as well, and you don't have to kind of bend over a bathtub. But some people don't necessarily have that option. We'll show you some options for that in a second. So some alternate bathing locations. I have bathed a dog in a Rubbermaid Tote before, especially little dogs. This works great. You can fill it with hot soapy water and really put it anywhere in the middle of the bathroom or outside. I have also done many a bath with my dogs in a kiddie pool outside. So filling it with soapy water, and they may want to get in on their own. So it makes actually a really good bathing tool that dogs don't really always associate as negative like the bathroom can be. And then this is little Scooby in the bathtub in his little laundry basket, which is one way that we can actually pick up dogs that have issues with being picked up. And I'm going to show you some videos of that in a sec. We talked about the bath using that simultaneous conditioning. So we definitely always want to have some sort of food item, whether it be for our traditional counter conditioning, where we're going to click and reward behavior throughout, or if we're going to do simultaneous, which, like I said, is one of the more practical ways to actually accomplish many of these tasks. So let's show Scooby learning how to get into the laundry basket. So this is a collapsible laundry basket. I've just bought this off of Amazon. So it can go all the way up into a full-size laundry basket, but it starts low to the ground like this. So I'm going to get him used to getting into it on his own. And you can see how excited his little nubbin, he gets very excited for training. So he has a behavior already to move forward by me tapping my finger. And so I thought I'd try that. It didn't work. So instead I lured him into the basket using a treat. And so now Scooby's trying to figure out, what are we doing? He's like, I'm not really sure about this. So I used a hand target thinking maybe I can lure him in to a certain extent by using a hand target. So he's offering some behaviors there. He's like, maybe if I lie down, I'll get treated. And what I did was I actually waited for his to foot. He actually pawed it with his paw, and I clicked and rewarded that. So I clicked and rewarded again that he pawed it with his foot. Any interaction with the basket gets a click and a treat. And so I waited for 2 paws there and clicked and treated that. And now I'm going to turn it around and see if I can get maybe 4 feet in, because it's lengthwise this time, but he's not really having it. So again, he's kind of throwing out some behaviors there. He's like, what if I paw it? What if I don't know. So I wait him out to see, is he going to actually get what I'm asking him? He's learning the parameters of what the behavior is. All right, so here's another, it's actually a client of ours that has taught her dog to get in the laundry basket as well. He also does not like being held or picked up. And so once he's in the basket, then we can safely actually grab the basket and pick him up and carry him, because it's a trained behavior for him. So there he jumps in, she clicks, and she treats. All right, so many times, especially when they're doing a medicated bath, so the veterinarian has prescribed something that is medically necessary to bathe them in, you must let those shampoos sit for 10 minutes after you apply it. And so most of my owners go, what do I have to do? Like, keep the dog in the bathtub for 10 minutes? There's nothing that says you have to keep the dog in the bathtub or the shower for 10 minutes in order to keep that shampoo on. And so what I recommend is, take the dog for a walk. Obviously you can't do it when it's 20 degrees out, but during the summer, this is really nice. You could actually just take the, soapy dog out for a little walk and they don't care. That way it sits on the skin and you can comply with the directions from your veterinarian. Ike is a big fan of ball, and so if he had to have a shampoo that set for 10 minutes, I would go outside and play ball with him. And most people will go, well, but they're going to get dirty while they're out there. Well, you're just going to rinse it off anyway. So you might as well, occupy them in a way that's enjoyable for them. You could certainly occupy them with about 10 minutes of training in the walk-in shower or training in the bathtub. That would be other options, but I find these to be the easiest. So this is actually Courtney. She's one of my trainers, and she is going to desensitize her dog June to wipes, medicated wipes. And I love this video because it shows this from essentially the start of, I am going to expose this dog to these wipes, and you'll see June's reaction and how Courtney overcomes that through some training. So she shows her the wipes, and you can see June clearly says no thanks. So now how is Courtney going to get her back out? She's going to use food. So she just sets the wipes down, talks to her in a nice voice. She's never forcing her to get closer than she wants to. She tosses food away. And June is saying, maybe I'll go back in my kennel. No, thanks. And Courtney's waiting to see if she makes, a different decision. When she doesn't, she says, okay, fine, I'll throw you some treats. And June gets a little closer, so she tosses her some more food. The whole time, Courtney's just getting her used to the presence of the wipe bottle. So you can see a dog that has a really bad history with stuff like this, that it may take a while. It may not be something that can be trained within a 5-minute session. She's using other behaviors like her hand target to get her closer to the wipe bottle. And when she's like, okay, that bottle is not so scary. In fact, she even nose boops the bottle. So once she realizes that's not so scary, then she'll progress to opening the lid. Because there are, some smells to it. Well, that was a little too much for June. So she says, no, thank you. I'm going to go back into my crate. So then Courtney's going to have to take a step back because that was a little too much for her. And that's where she ends the session for the day, because she doesn't want her to get too overstimulated. This is Kayla, one of my other trainers, working with her dog Grady on desensitizing him to using the wipes in his ears. And she is using the chin rest behavior here, which Grady knows. So watch her training process here. So she starts out with just, reinforcing that good chin rest behavior that he does. And she's marking. Now she goes to just touch the wipe. Pick up the wipe. So she's doing every little step and making sure that Grady is completely comfortable with every step before she moves on. So she moves it a little closer. And she's rewarding him for every little incremental thing that he's doing. So she hasn't even gotten it anywhere near his ear yet. She's still obviously just bringing it up towards his face. And she barely touches the tip of the ear there. And she treats him away just to say, if you want to leave, you can, but he chooses to come back. Oh, no, he doesn't. He says, you know what, that may be enough for me for this session. But then he pops up and says, okay, I guess I'll work again. So your dog is able to say if he wants to actually participate in this, which is one of the really wonderful things about using a start button behavior, is that they are consenting to this interaction completely. So it gives them autonomy. All right, so I'm going to work with Ike here on desensitizing him to using a topical mousse. There are a lot of products out there, dermatology-wise, that your veterinarian may prescribe, like a topical mousse, a topical lotion, something. And not only do they smell, but they can feel weird. They can feel tingly on the skin. So we have to desensitize them to this whole process. So right there, I'm just clicking and rewarding for interaction with the bottle. You sniffed it, great. He also thinks thinks I want him to nose boop it. So you see, I'm not moving on to actually doing anything with the bottle other than I need to hold his paw also in order to apply the topical. So, and again, this is the reason why that ring click is really nice, because you can see I'm still holding his paw with the clicker, but my thumb is able to touch the clicker and, make sure that he gets that marker that says, yes, that's the behavior that I want. So right there, when I put my hand out, he actually thought I wanted a chin rest, which is not what I wanted. I wanted a paw. And he pulls his paw back. It's hard because there's no sound to this, and I apologize, but he does pull his paw back after the click has happened. So he didn't do that before the click. So, he knows that, like, once the click happens, the behavior is over and he can do whatever he wants to. So he decides he wants to stand up for this process, and that's okay with me. So now, instead of just using the wipe or the stuff, I'm just working with him on my hand, touching him. Oh, and he says, nope, that's too much, Mom, thanks. But again, he comes back for it. So I'm able to then put the mousse on his paw there and rub it in, and I click and I treat. So he says, okay, this is great. I'll just sit here and work, right? Then I go to the other paw and he says, no, absolutely not, lady. You haven't trained with that paw yet. So you can see that he is very clear in his signals. And I will tell you that Ike does have what we call conflict aggression. He will use aggression as a behavioral strategy if he is not comfortable with any of my handling. So he is very clearly there pulling his paw back. So thankfully he's saying no without actually doing anything more severe, which he has been known to do. So we're going to do some desensitization to ear cleaning here. The other nice thing about the ring click is actually how pretty quiet it is. So I am able to hold his ear up and still use the click, and it doesn't bother him even though it's right next to his ear. So you see, I'm kind of doing what Kayla did where, you know, I may be touching his ear in the beginning, and then I'm going to just touch the bottle and pick it up. He thinks he needs to rearrange the mat, apparently. And he'll sometimes do this too. He will lay off the mat because he knows that I can't get to him. And so he is not consenting to interaction there. But I will use some known behaviors, something very easy for him, like a hand target to kind of get him back. And then I'm clicking and rewarding. And because he's so far away from me, I do scoot forward. And because he started to kind of back up, I realized he wasn't comfortable with the whole ear process. So instead, I'm just going to touch the top of his head and scratch him a little bit and just reward for that. So now we're just back to touching his ear and opening up that flap so that I have good access for the bottle. And you see he says, nope, too much, take it back. When he gets frustrated, he oftentimes paws things. So he pawed the bottle. So I realized that was too much to be able to pick that up right there. So I just set it in front of him and went back to work on, you know, opening up his ear canal. And this is a really difficult behavior for Ike because all of his handling issues stemmed from a very bad ear infection he had very early on as a puppy. And so ear cleaning for him is incredibly stressful. And so we have worked on this his whole life. And so it's one of his most difficult behaviors. So I definitely need to use my highest value food items. I have to go very slow. We have to take a lot of breaks. And I have to go at his pace and comfort level, not mine, because of course I would like to push further. And most trainers are way more patient than I am with my own pets, and I'm way more patient with my clients and their pets than I am with my own. So we're back to just picking up the bottle, clicking and rewarding. And he's still consenting because he's still here. Pick up the bottle. He shirks a little bit, but he stops. So we went ahead and clicked and treated that. But you can see that's very clear of no, thank you. You're going too fast. So now I'm just gonna reward him for some interactions with the bottle itself. Just remind him this is not so scary. You don't have to worry about it. So he's doing a little nose touch to the bottle and getting rewarded for that. I'm touching it to the side of his face now so that he could get comfortable with the bottle next to his face. So I hold his ear and the bottle and click and treat. Again, bottle, click, treat. Now the bottle's closer to your ear and touching your ear, click and treat. It's touching the ear canal. You see though, the bottle isn't open. The bottle isn't, even facing the right direction at this point. We're doing every little step as long as he is comfortable with it. So now I'm turning it over because obviously I'm going to have to have it in that position. The nozzle was actually sticking down a little bit into the ear canal on that thing. Now it's down in. We're clicking and treating. He says, no thanks. Too much. Take it back. So we reset him a little bit. He comes back. And we're able to start right back where we were because he is comfortable with that. And he got a little break too, which definitely helps him. So in that one, actually, and you can't really tell it, but I did actually squirt a little bit of the medication or of the cleaner into on that one. All right, so toothbrushing is another thing that your veterinarians will recommend. So how do we brush dogs' teeth? Very similarly to how we brush our own, all surfaces, and ideally, if we're being honest, we should brush their teeth probably twice a day, every day. But I know even as a veterinarian, don't do that. I would like to get at least once a week in with my dogs. These are the most common toothpastes and toothbrushes available, the CET products by Verbac. They are flavored toothpaste, so there's poultry flavored. I think there's a beef flavor, and there's like a vanilla mint flavor that some cats will like. Some dogs like it too. This is a video by a trainer friend of mine, Sky, and her dog Merrick, who she is actually showing how to demonstrate the lip lift rather, and showing those teeth before we get to the actual toothbrushing. So he is doing some cooperative care here. So he is not only doing a mat, he also does a chin rest behavior. So he's almost got 2 start button behaviors here. So he's got a nice chin rest and he's performing that behavior while Sky looks into his mouth and looks at his teeth and says, you know, is there any tartar? Is there anything, are they cracked or anything like that? Do we need to take you to the veterinarian? And the whole time he's holding that chin rest behavior because he's saying, I'm allowing you to do what you need to do. And it's just part of our training process. So instead of doing just the lip lift, you would also implement the toothbrush and toothpaste. You could do the toothpaste just on your finger if you needed to. We do have some patients who are incredibly resistant to handling of their mouths. And so this is a very long process for some of them. So in the meantime, there are products made by the CET company, the Verbac, and their CET products that are essentially dental treats that can work to help break down some of that tartar and plaque. So the veggie dents are really nice, especially if the dog likes crunchy things. And so if they really like hard treats, those are the best ones for them. They can chew on that, and that mechanical crunching will help break down any tartar, but also they're actually impregnated with basically the toothpaste. And so the CET Hextras are the same thing, but they are those pressed rawhides. So if the dogs like those, with these, I do, have owners will say like, well, I worry about rawhides, obviously, because what if they swallow the whole thing? Because they are pressed, they will dissolve. And with the veggie dents as well, if they're going to break off big pieces, I may not give them to them, but they are designed to actually dissolve if they swallow the entire thing. So those are good sort of stopgap measures, and especially for those of us who do not brush their dog's teeth every day. My dogs get one of these every single day in the meantime. All right, the dreaded nail trimming. So most dogs are not comfortable with nail trimming because, let's be honest, we don't work on it enough when they're puppies, as well as dogs in the wild don't get their nails trimmed. They wear them down themselves by running around. And so us doing a nail trim on a dog is very, very scary for some dogs. So this is actually Mandy Akins, who was one of my trainers back in Kentucky. And this is a dog who actually bit a veterinary technician on the face. He's like a 7 or 8 month old German Shepherd when she was trying to restrain him for a nail trim. And so he was sent to Mandy to work with to get comfortable with nail trimming. So you can see his nails are too long in the front there, especially on that left paw. So Mandy's saying if you have a good stay, that's ideal. Laying down is the most comfortable position to be in for dogs for their nail trims. And the first thing that we teach them is just to interact with the clippers. So she's doing just a paw target and allowing the puppy to, you know, interact with those clippers in a way that he is comfortable. And so once he's totally comfortable with the presence of the clippers, then we're going to move on. So next we want to introduce the nail trimmers around the toenail, because obviously the pressure is another piece to that. So the dog pulls his foot away because he's not as comfortable. You can see this next time is more comfortable, not so scary. And all she's doing is touching the trimmers. Now she's going to start applying pressure. She's not actually going to trim, but she's applying a little bit of pressure because that could be scary too. And it's part of the process of desensitizing him. So again, this process may take multiple sessions and you need to work at your dog's comfort level. But actually this video was one session with this dog. And again, this is a dog who bit a technician in the face because of a nail trim. So once the dog's comfortable with the trimmers and feeling that pressure, it's time to actually make that first cut. So she is just cutting the tip off because, as we know, black nails are difficult to assess where that quick is going to be. So you don't want to actually quick the dog. So she has already cut 2 nails in this process. Now, granted, Mandy and myself as a veterinarian, we are much more comfortable with where we can actually trim those nails. And so we don't have a lot of time. We're not, having to kind of like angle it and get it right at the right angle. But if that is not the case for you, that would have to be part of your training process. So you'd have to work on, being able to manipulate those trimmers, making sure that maybe even holding the nails one at a time so that you feel comfortable trimming it where it is. All of that is going to have to be part of your process in training too. So this is also Merrick with Sky, and she's doing a similar thing. She is going to show you, and he's just hanging out on the couch right now, and she's going to trim his nails. So you can see how comfortable he is, and she's holding. So again, that would have to be part of your training process, is to actually hold that foot and or, expose the nail. Ike has a lot of fur around his nails, and so we have to also peel back the fur a little bit and then trim. You could also do this with a Dremel, but you would have to get them comfortable with the noise of the Dremel, the presence of the Dremel, the vibration of the Dremel. All of those pieces are going to have to play into your training plan. So he pulls back a little bit right there. He's not as comfortable. So she goes back and says, I'm just going to work with him. She's also checking to make sure she didn't quick him because he did pull back quite a bit. But she can see that there's no blood on there, so she didn't actually quick him. And she's able to trim another nail. So again, maybe he's not as comfortable as I would prefer. And I know that Sky, I'm sure, has looked back at this video and said, but she did have to check there to make sure she didn't quick him too, because those darn black nails, you want to make sure that they're not bleeding. But he's a little bit more uncomfortable than I would prefer. So, maybe just doing 2 nails for one session. So some alternates to nail trimming, because nail trimming is so darn scary for some of these dogs. We can actually train the dog to trim their own nails, or file their own nails rather. This is Mike, Mandy's husband, and their dog Ryder, and he is working with her on a paw target. So the dog knows a paw target. Basically, I touch my paw to something, whether that be I shake your hand or what. But this is a 40 grit sandpaper circular disc that has been glued to the butter dish lid, essentially. And Ryder is scratching and filing their own nails. So some options you could make, like I said, with the butter dish lid and just a 40 grit circular saw sand disc. These Full disclosure, Paradise Paws LLC is my daughter's Etsy shop, and she actually makes these nail file scratch boards that have 80 grit sandpaper on them, and you can teach the dog to rake their paws down the board. You can also use, like I said, a Dremel, but you could also just use a nail file. So just these very cheap, thick, high grit nail files that are typical for most salons actually work great to sand down dog nails. And so sometimes that, because of that pressure is an issue and the vibration is an issue from the Dremel, just sanding them down with a nail file can work for some dogs. All right. So administering medication. This is a difficult one, especially for kitty cats. And so I'm going to focus on cats here especially. But so this, cartoon displays it. Obviously, owners, when they get the, the pills from their vet that the vet says you have to give this to your cat twice a day for the next 10 days, they need some Xanax themselves because they're going to have to do this. So how do we get cats used to it? Well, first of all, for dogs and cats, there are many options to be able to hide pills. So Greenie's pill pockets work for the majority of dogs, but not every dog is motivated by those, especially when they're when the pill might be bitter, like metronidazole, which is a common GI medication, or trazodone, which is a very common psychotropic med that we use in veterinary behavior medicine. But liverwurst, or liver spread, or Braunschweiger, it's called if you're from Germany, is a really, really nice way to hide a pill. So this is just liver pate, and it's sticky and it's stinky, and it makes a really nice little meatball that most dogs will swallow. And I've even had some cats take this as well. But if we can't get a kitty cat to take it on its own, we can actually train the cat to accept a pill popper. So pill popper is essentially a little device, and you can see that in my left hand there, that we put the pill in the end of it, and then we pop it essentially like almost like a syringe into the cat's mouth at the back of their throat, so that it just goes down and they swallow it. So this is my cat Dobby, and we are getting her used to accepting the pill popper. All I'm doing is putting her canned cat food in it, and you can see that she is readily gobbling that right out of there. So I want her to love that pill popper first before I even want to use it for a pill. And cats are notorious for when they really like something, they want to gobble it right down. So you saw there at the very end when she was like, horking that down, that's when I would inject it or pop it. So we started with cat food, where you move on to something like a small pill pocket, and then without the pill, and then you move on to the pill pocket with the pill inside of it. So that's a very easy way that cats can actually take medication. And with that, I want to know if you guys actually learned anything. So that is a very quick husbandry at home overview with lots and lots of videos. And obviously we didn't go exactly step by step, but there's some other resources for you. So the first one is the Husbandry Project by Jean Dodds and the Academy of Dog Trainers. The Husbandry Project are free step-by-step training, oh my gosh, I'm losing my words. Training, it's the end of the lecture, you can tell. But basically a training plan, there's the word, training plan, that walks you through every single thing that you need to do, or whether it be nail trimming, giving a medication, sub-Q injections, all of that. And then also Karen Pryor Academy also has this course that you can take called Better Vet Visits. So it's designed for owners as well as veterinarians, veterinary technicians, to learn how to make veterinary visits much easier for your pet. So those are two resources. If you're really interested in this and you are a veterinary professional, or really interested in learning more about cooperative veterinary care, there are some great books out there. The Canine and Feline Behavior for Vet Techs and Nurses is a great book by Julie Shaw and Debbie Martin, both of whom are VTS behaviors. So they're veterinary technician specialists in behavior, as well as cooperative veterinary care by Alicia Howell and Monique Ferrielside, who are also VTS behavior technicians. So great resources for books, for learning more. And then there's also certification. So you can become low stress handling certified as a veterinarian, veterinary technician, nurse, or just an owner to learn how to, or a trainer even, to learn how to handle animals in a clinical setting in a low stress fashion. The other thing is fear-free. So I mentioned this at the beginning of the lecture. Fear-free is a certification within veterinary medicine. It started with veterinarians and veterinary nurses, but now has expanded to, they have a groomer certification, a trainer certification. They also have an owner certification. There's a brand new shelter medicine certification. There's an exotics course that's coming out. So you can actually learn how to take the pet out of petrified and help your pets and your patients not be so scared of things that they have to endure, like veterinary visits and grooming. And in terms of where to find more help, whether you be an owner or a veterinarian looking to refer an owner to somebody, there are trainers who are certified in those two things that I talked about, the Jean Donaldson Academy certified trainers, so the ones that develop the husbandry project, and then KPA or Karen Pryor Academy trainer certification, the ones with the Better Veterinary Visit course as well. And then there are people like myself, behavior specialists. So a veterinary technician specialist like my nurse, Jessie, a clinical resident in behavior medicine like my resident, Dr. Megan Ropsky, and I think there are now 60 residents all over the country, or a board certified veterinary behaviorist like myself. And there are, I think, 90 of us now in the entire world. It's a North American certification, so we're all over the US, Canada, but we also certify those veterinarians in Australia. And then many of our colleagues also work in Europe. So you can always find help from one of us. And with that, I'm going to turn it over to Deborah to look at the chat and see if we have any questions that I might be able to answer.
Okay. We can start with Madeline's question. She wanted to know how using a MAP behavior pairs with the training the place behavior.
I don't know that, I'm not sure I understand actually the question.
Yeah, I'm wondering, I always thought MAP behavior and place behavior were the same.
Yeah, and maybe that's what she wants to know, and they are. So I call it a MAP behavior. You can call it a place behavior. It's just a sort of a location or an identifier like that mat. I like the mat rather than a location just because I can take that mat everywhere with me. So I could do that at the vet clinic. I could do it in my bathroom. I could do it in my bedroom, as you saw in the videos. It's just a nice mobile thing versus like a corunda bed, which a lot of trainers will do a place behavior to like a bed, which doesn't really, go mobile very well. So.
And can you touch on dogs that will let their owner do all the handlings, no problem, but not others?
Yeah, so that means that they haven't generalized that behavior. So Ike is very similar in that fashion. And part of the reason that he has not generalized is I'm also his veterinarian. So he doesn't necessarily have to generalize some of those behaviors. But the veterinarians that are fear-free certified will let you come and do what we call happy visits at their office. So Christine, one of my trainers, also has a dog with major handling issues. And so she will take Gemma, her dog, to the clinic, and she goes to Franklin Farm, that clinic in Herndon, just to give a little shout out to them. She will actually take Gemma over there, and they will generalize some of her mat behavior, her chin rest behavior, so that she can take that show on the road, essentially, so that other people can do that with her. But that's really what's happening is they haven't generalized.
Okay. Let's see do you have a video of the towel wrap?
On the low stress handling website, there are many videos of that. And so you can actually download those. I think they also have a YouTube channel available as well. So Dr. Sophia Yen's stuff is still available, even though she is no longer with us.
And Anne wrote that her small dog, if lying on his side or back, when she tries to brush his very furry paws, will sometimes have one front leg shake or tremble. Is that normal?
So that probably
Or
means
if something isn't wrong?
yeah, it probably means that a couple things. Number one, maybe they're too anxious about that interaction and they're not actually consenting to it, but they don't know what else to do, like escape. Or it could be painful too. So I would definitely check with your veterinarian to see maybe there's something wrong with the paw or the nails, or even deeper, like bone pain.
When training a puppy with a start button behavior for grooming, which start button do you recommend beginning with? The mat, the chin rest?
It's gonna really depend on the dog. So I like the mat behavior for large dogs, and then the chin rest for a dog that maybe needs to be like on a table, like a grooming table, something like that, to set their chin into your hand. But you could see that Kayla did the chin rest in her lap. So that's another option if he needs to be standing. I actually like training both of those behaviors for each dog and then utilizing them where I need them to adapt to. So both is the answer.
Okay. When you are training and the dog leaves or displays that he is uncomfortable, recommend ending the session? Do you recommend going back to an easier step to end on a good note?
Yep, I actually recommend going back to an easier step to end on a good note. So oftentimes, like with Ike, if he leaves and I know he's done, I'm gonna actually just do a couple hand targets, maybe just get him in there for some hugs and some loving, and then we're gonna end the session. So I don't ever want to end on a bad note. I want them to remember those training sessions as very positive as much as possible. Good question.
And here's a question about desensitization and counter conditioning. How long to practice? Do you have a suggestion about how much to do at a time, ensuring that we're creating those positive associations?
Yeah, good question. So most dogs really only have the tolerance level to do maybe 5 or 10 minutes of training at a time. So that's what I would recommend a few times a week. Most owners, that's all I can really expect of them. Me as a busy mom and professional, I rarely have time to train my dogs. So it may be a couple times a week, once on the weekend, once during the week, but 5 to 10 minutes at a time is really all they can probably handle. And so that's where I would leave it at.
Would you recommend all areas be trained before there's a problem?
Absolutely. So these are things that ideally we would like to get on board from the get-go, from puppyhood. But the nice thing about the videos that I showed too are dogs that also had issues prior to. So these are not naive dogs that had no problems. Ideally, that'd be great. To be perfectly honest, I had not trained anything with Ike on terms of handling of ears until he developed that ear infection. And so I was in an uphill battle, and because I needed to get it done very quickly with him. And so again, that is a wonderful question. Ideally, we'd love to start this from 8 weeks of age when we get those puppies.
Teresa wants to know how you train the chin rest.
So it's gonna depend on the dog. Sometimes we'll use a lure. So I may put out my hand like this, and let's say the dog is facing this way, and actually use a lure to lure that nose with a treat and click. Some dogs, with Ike in particular, I can actually touch him under there, and that's how I started. So I just actually touched him under his chin and then clicked and treated. And now he knows, he has generalized that behavior to, if my hand is out, he is to put his hand into it. So it's really going to depend on the dog and their comfort level with handling. Good question.
How do you feel about raw bones for tooth care?
I'm not a fan of raw bones for a couple of reasons. Number one, they can be sometimes too hard and actually crack a tooth. So the veterinary dentists don't recommend them. But also, of course, there's the issue with raw food in general, just being having bacterial load and that kind of thing that, especially if you have little kids or elderly in your household, we don't want to expose them to certain bacteria. So I would prefer the VOHC rated products. So that's the Veterinary Oral Health Care. It's a council, basically, of veterinary dentists that approve those types of products, like the CET chews.
Do you have a suggestion, or do you suggest nail files for the back legs?
Yeah, the nail files can work great for the back legs too. So you can either use the salon style one, or you can teach a rear paw target. So it's a more difficult behavior to train from a training standpoint, but actually you can teach them to use that back leg to scratch on the scratch board as well. So depends on your comfort level and your dog's comfort level, but either one is fine.
Are the suggestions you use for toothbrushing good for cats as well?
Yeah, so the CET products are labeled for cats as well. I don't believe the CETs have chew bones for cats, but Greenies makes feline greenie tartar chew. That's essentially like a little treat that works really well too. And I believe that those are VOHC rated as well.
I am zipping through. There are lots of thank yous. Let me see if there are any more questions.
Thank you.
How often to clip nails?
That's going to depend on the dog or the cat and how often they actually sort of wear them down themselves. So dogs that are walked on concrete so like sidewalks, will wear their own nails down fairly readily, especially the back nails. Some dogs' nails grow much faster than others. For my own dogs, they get trimmed about every 6 to 8 weeks, depending, but we don't walk on concrete. So we have kind of woodsy trails that we like to walk in, and so it doesn't wear them down as readily. So it really is going to depend on the dog and cat.
How would you know if your dog has ticks or mites?
So a couple things. Number one, ticks, you may see them. So they look like a little black, I hate to use the word, but look like a little black nipple in a place that's not supposed to be. And mites oftentimes are microscopic. So the microscopic, you're not going to see them, but you may see hair loss, redness, itching, that type of thing. So for ticks, you definitely want to check your dog, especially if you go out in the woods and they're not on a tick preventive or tick repellent. And you'll definitely want to check them and make sure that you are seeing if there are any and taking them off. With the mites, you're going to look for the other clinical signs of like the itchy, redness, hair loss.
Do you have any recommendations for low stress handling for cats? Maybe something she could look at online?
Yeah, so the low stress handling website, Dr. Sophia Yen's stuff, has a lot of stuff for cats, as does Fear Free. So if you can actually become Fear Free certified as an owner for free. And then there's a lot of videos and stuff that you'll get access to. And a lot of those include cats.
And how do you take care of tear stains on a white dog?
Those can be difficult because there is normal stain in your tear production. So on a white dog, it's especially noticeable. But using some of those medicated wipes that your veterinarian may carry to help wipe that away, as much as we can get wiped away sooner, it doesn't sit there and actually stain the fur. That you can also apply a little bit of Vaseline to that area too, so that's safe. If it got into the eye, it's safe, but that will help prevent the tears from absorbing into that white fur right there and just kind of roll off because the oil and water don't mix.
Sandra says that her dog tries to bite the brush when she brushes him. How can she get him to stop this behavior?
Yeah, so with that behavior, he's telling you that he's not comfortable with the brush. So you need to start lower and maybe just work with like a mitt or something, like a brushing mitt. They make those especially for cats, but it works for dogs too. And you just get them used to, brushing some of that hair. But your dog is using aggression as a behavioral strategy to say, hey, please stop. So you're going too far too fast. Maybe using like a higher value treat and using that simultaneous conditioning of like, here you focus on the peanut butter smeared on the dishwasher, which I've done before too, while I brush you. So you're going a little bit too far too fast.
Can this start button behavior be used to train a dog who is fearful of staying home alone?
You can. It's a little bit different in concept because we're really more doing true like relaxation for that. So I would prefer like relax on a mat, which could be your same start button mat behavior, but it's just a little bit different in terms of kind of the outcome, so to speak. So similar but slightly different.
Just to mention, since it's relevant, your dog's friend has a separation anxiety online class starting in March, and we're going to have another separation anxiety webinar on February 27th. So you can look those up on our website. Michelle says her dog has recently started to growl when attempting to dry her off with a towel post-bath, especially at her hindquarters. What do you suggest?
Well, since it's a new behavior, I would absolutely check with your veterinarian to make sure that there's nothing going on in her hind end. Maybe she is developing some arthritis in her back or her hips, and she's actually painful back there. Whenever there is a brand new behavior, you absolutely want to take your pet to the veterinarian because behaviors don't just crop up unless there's a traumatic event. So you want to make sure that you rule out medical first and then working slower, maybe working with just a hand towel instead of the big towel, maybe, avoiding that area until you have a higher value treat on hand, those types of things. But definitely seek care from your vet first.
Steve says that his dog accepts the muzzle, but he wants to know how often he should practice putting it on him and for how long to keep him muzzle trained.
Yeah, so I would do it at least once a month just to kind of remind them that the muzzle's a fun thing, at least. I mean, you could do it a couple times a week. You could put the muzzle on and take the dog for a walk. So it's associated with something high value like that too. And how long to leave it on is going to be up to the comfort level of your dog. So if your dog is trying to get it off after 10 minutes is too long. And we're going to have to backtrack our training up a little bit and make sure that they're comfortable for longer. So that's going to be very individual.
Joel has a little Havanese puppy who is very squirmy and high energy. Won't stay still. So Joel is wondering how to trim his nails.
Yeah, so you may have to get two people involved in this, but you can also use that simultaneous conditioning as well. So the simultaneous conditioning, you smear a licky mat or something with like some canned food, and then that way the dog is focused on that, and you can actually start touching nails, touching paws, working with the nail trimmers, etc. But sometimes having an extra set of hands in there can help too.
Steve wants to know how to teach his dog to use a hand target and a chin rest. I'm thinking that maybe Kiko Pups would have a video of each of those.
I think you're right. I know Lori Luck, who's a local trainer, has a great hand target video out there on YouTube. And then Kiko Pup has a lot of stuff. So KIKOPUP. She's got a lot of fantastic videos of stuff like this.
And Lori Luck would be Smart Dog University.
Smart Dog University. Yes, ma'am.
Let's see if there are more questions. When I try to remove the leash from my dog, he tries to bite me, so he walks around with his leash on while inside. Um,
So,
what
couple
to do?
things. Yeah, so you're going to have to train that behavior. So just like any other behavior that we talked about today, I'm going to reach for the leash and give you a treat. I touch the leash, I give you a treat. I maybe just touch the metal, I give you a treat. Or you could use the simultaneous conditioning and smear some peanut butter on your dishwasher. And then while he's focused on that, then unhook the leash. So that means he's not comfortable with that behavior. Anytime an animal uses aggression as a behavioral strategy, it's telling you, hey, back off, I'm not comfortable with that. So we need to figure out how to make them comfortable with that.
Karen would like you to go over giving eye drops to a dog.
Yeah, so eye drops would be something else that you could absolutely train with this. I like using the chin rest for the eye drops because if you do a chin rest and then slowly lift the dog's chin up, so do successive approximations of, lifting your head up, then the eyedropper over top, you can squeeze a drop in. Some dogs, you don't even need to pry the lids open. You just do the one drop and they, blink normally. And that's all you need to do. So that would be very similar to like the ear cleaning situation. Good question.
And Carol would like to know how to desensitize a young dog to men.
Yeah, so a lot of dogs, for better or worse, are a little bit more scared of men than women typically. And so you would have to make sure that you are keeping your dog at a distance away from a man that maybe is, sitting sideways to your dog, so they're less threatening. They're not looking at your dog. So you have to have someone that you could use for this training scenario, and making sure that you pair that with a high value food item. So you're working on desensitization and counter conditioning at the whole time while your dog is comfortable and under threshold. So depending on how uncomfortable they are, it's going to be a process. And some of those patients may also need medication, which is where a veterinary behaviorist can play a role as well to help decrease fear and anxiety.
Okay, here's one again on how to teach his dog to use a paw target. Again, Kiko Pup.
Kiko Pup probably has some good ones. I know Mandy's got some stuff on her place as well. It's called Manners Matter Kentucky. And so paw target is really just teaching the dog to shake, essentially, but then you just swap it out for something else like that nail file board. But yeah, Kiko Pup's got some good stuff. Trying to think who else would have good videos of that. That's all I can think of right now offhand.
Alina says that her puppy shows resource guarding behavior toward the towels and any kind of mats. So how would she work on a mat behavior?
Yeah, so you could actually instead do just a location. And I've done that with like painter's tape, just kind of block off a little square. And so when you're in that square, then you're working, and that's your start button behavior. Because Ike, as a puppy, would do the same thing. Actually, he would grab that mat and he would run away with it and would resource guard it. So initially we just did a location, and then once he was sort of through that puppy phase of stealing all of the stuff, then we worked with the mat itself. Good question.
Steve has heard about a solution that you add to a dog's drinking water as an alternative to toothbrushing.
Yeah, there are Verbeck, that same company, the CET company, makes a water additive that is essentially chlorhexidine, which is a antiseptic, which is what toothpaste is essentially, that can help. I've seen good success with some dogs and others not so much, because some dogs don't necessarily keep that water in their mouth all the time, right? They lap it up and swallow it right away. So it may not necessarily bathe all the teeth, but it's something else that you can do for sure.
Lana wants to know, why not shape a chin rest instead of luring?
You could do either one. That would be absolutely fine.
Okay. Kimra, what should I do at this time? My dog is missing teeth and we haven't been able to get x-rays. His teeth are terribly bad and his breath is bad. What has gotten in the way is that he is fearful.
Yeah. So I would definitely schedule an anesthetized exam with your veterinarian. So I would, they would need to be fully anesthetized, intubated and on anesthesia, inhalant anesthesia. So that way they could do the dental x-rays, make sure, are there teeth that need to be pulled? Are there teeth that are fractured, have abscesses, et cetera? And then they could do a good dental cleaning while the dog is under. But that's the only way you're probably going to be able to accomplish that.
All right, let me zip up here again. What is the name of the company on Etsy for nail scratch boards?
My daughter's company.
Is it on Etsy?
It's on Etsy. It's Paradise Paws LLC.
Okay.
Yeah. And again, full disclosure.
Somebody's comment. I've had good success trimming one of my dog's toenails each morning before we go for a walk. So we do one nail every day. He can easily tolerate one, and his reward is to immediately leave on our walk.
Perfect. That's perfect. Yep. Good job.
Yeah. How might you handle a situation where the dog offers the start button behavior, but is showing slightly uncomfortable body language, like holding the chin rest, but flicking his ear back when you reach for it?
Yeah. So it's going to depend on if that escalates or not. So like for Ike, he will occasionally flick his ear back, right? And you saw, again, one of the reasons we video ourselves training is to see where should I have maybe taken a step back. So if they are not totally comfortable with that full chin rest, then we may need to do duration of the chin rest. As you know, we don't click until we get to 5 seconds, and then it's 6 seconds, it's 7 seconds, and then we're going to implement, you know, me reaching towards your ear or whatever the case may be. So every dog is going to be very different. What we don't want to do is push them over that threshold, right? And so depending on their comfort level, previous comfort level and previous traumatic history, is going to depend on how much I can and cannot push. But videoing your training is really important to really watch that and see, you know, sort of post hoc, what could I have done differently?
Bethany says her dog has a history of being forcefully muzzled. How can she train it to be conditioned at this point?
Yeah, sometimes changing the style of muzzle can help. So maybe switching from that Italian basket to maybe like one of the biothane muzzles, because there isn't that negative association with it. I've even just done for some of those dogs, because there are some dogs that come into my practice like that as well, where I smear peanut butter or easy cheese in it, and then I just lay the muzzle on the floor and walk away. And the dog is free to explore that completely on its own and realizes that this thing isn't so bad. It has nothing to do with me. I'm not going to shove it on his face. So that's going to take a longer process, though, when they have a traumatic history like that. Ike's ear issues, because it was so traumatic for him, has been a long process for him, too. So anytime there's traumatic history like that, we're going to have to take it slower.
Chantal wants to know where she can sign up for the free owner low stress dog training.
Yeah, so there's not like low stress dog handling that's free, but there is fear free for owners that is free, and it's fearfreepets.com. And you just go to the pet owner section and it'll walk you through all that process.
There's another question about giving eye drops. Karen, this whole thing will be on YouTube and on our website. So you could look at an earlier question about that, or do you want to go over it again, Dr. Pike?
Yeah, I can just quickly do it. So basically, using your chin rest to your advantage, and then successively, pushing the dogs, having the dog do a higher chin rest, basically, so that their eyes are, directly below where you're going to give the drops. And then most dogs, you don't need to pry those lids open. Even with cats, you don't need to pry those lids open. And you just do one little drop, and then they're done. But you're going to have to shape every single part of that, just like we did with the ear cleaning.
Kelly wrote, I'm assuming desensitizing a dog to cars involves taking similar steps. How do I avoid flooding my dog when we're in the process of training, sensitizing, but I must put my dog in the car to go somewhere?
Yeah, so if they're that terrified for a car ride that you are worried about that, and that is a definite concern, you may want to ask your veterinarian or seek out care from a veterinary behaviorist for a medication to use in the meantime for car rides. Because ideally, when we are doing desensitization counter conditioning for a process, whether that be a car ride or eye drops or ear cleaning, we don't ever want to do anything that pushes that dog beyond that threshold, because you do run the risk of sensitizing them. So, but you can use medication to your advantage, and that's what I did with Ike when he was not yet trained for all of this behavior with his ears and developed that ear infection. Is I used medication to my advantage. So I would give him an oral anti-anxiety medication about an hour and a half before I actually needed to clean his ears and do his medication, so that it was much less stressful for him in the process, and worked on the training sort of through that treatment too. So that's a really good question.
Grace wrote, how do we desensitize our dog to outside things when he is inside? There's a cat who lives next door that he will bark aggressively at, even though we have our own. I try to give him a treat whenever he sees me, but he gets stressed even after.
Yeah, so you may actually need to block his visual access to seeing the cat in the meantime. So you may need to put up like, frosted contact paper or something, so that he can't actually see that cat outside of a training scenario. So then you could, peel back the contact paper and work on it. But oftentimes that can be very hard, because he may see the cat when he's out in the backyard and get worked up. Also, another place where medication may be appropriate. If he is seeing that cat so frequently outside and is stressing him out so much that it's affecting his quality of life, perhaps a daily medication may actually help him.
This question I'm having trouble understanding, but maybe you can. Would you recommend using high-value treats? Dogs can cross their own boundaries to just get that treat and or suddenly notice the aversive stimuli and use aggression.
Yeah, I do understand where this person is coming from. So they're saying the dog is so food motivated that they'll sort of overcome the fear, come close for the food, but then they're too close to their own trigger. So like, especially when we're working with unfamiliar dogs to me, or like a new patient or so, I do treat and retreat is what we call it. So I will toss the food away from me so that the dog has the opportunity to escape and go get the food, versus come close to me, the scary trigger, because he's so food motivated. But then once that food's gone, then there's just a hand there. So if the patient is so food motivated that they will do that, sometimes we actually have to lower the value of the food item we're using, so that we balance that. Okay, I'm willing to just be here because that food is so amazing, but I'm not really willing to interact with you in any other fashion. So sometimes lowering the value of the food. So it's going to be so many things play into everything that we do in training. It's going to depend on the scenario.
Do you have an opinion on plaque off?
Plaque off, I don't think is VOHC certified. So because it does rely on some abrasives, like an acidic component to help break that down. I think I'm thinking of the correct product that you're talking about. You just want to look for the label VOHC, and if it's not VOHC certified, I wouldn't use it.
Okay. Sandra says that her 6-month-old puppy is potty trained, but there's one spot in her house where he had an accident and he keeps going back to that spot and marking it. She has steam cleaned it and used enzyme spray. What else can she do?
You could block the spot with, piece of furniture, an ottoman until he's, maybe a little bit older. But I would maybe consider a professional cleaning. Sometimes, even though we use that enzymatic cleaner, it doesn't always get down to the carpet padding and that kind of thing. Whereas professional steam cleaners often can.
Here's a good one. How do you train a dog for an anal gland examination?
That is a good one. So obviously they're going to have to be comfortable with all of the handling process. So oftentimes we'll have to have a veterinary technician with their hand underneath the dog's abdomen to keep them from sitting down. If they have a long tail, someone will have to keep the tail up. And then all of that touch sensation back there. So sometimes those situations are best done in a training scenario with the vet involved so that they can glove up and do everything that they need to do, but never pushing them beyond that dog's comfort level. So either using your simultaneous conditioning and allowing that dog to eat, easy cheese or peanut butter on the exam table while you're doing it. But if you don't, again, want to push them over a threshold. So if they are too uncomfortable, they're okay for you to touch back there, but they're too uncomfortable for actually sticking your finger in there. Because we do have to get it's a rectal exam essentially to do anal glands. So we do have to get our gloved finger inside there. If that's too much for that patient, then either stopping before that, right? So we never want to end on a bad note, or using medication, anti-anxiety medication situationally, so that it isn't so stressful for them.
This is regarding an earlier question on the trembling leg.
Mm-hmm.
Anne says that she's asked the vet twice and the groomer and neither sees anything wrong. Could this just be stress? She worries that it's a nerve issue, but the vet dismissed it.
Yeah, if your veterinarian has examined the dog and doesn't feel like there's anything there, then you of course could get a second opinion. But behavior is a rule out diagnosis. So if it's been ruled out that there's something medical going on, then yes, it absolutely could be stress, that he is not happy with you, brushing his paws like that.
Also, concerning the scratch boards, if the dog doesn't scratch because he feels his nails are good, but the owner thinks he doesn't understand what to do, and isn't the dog only scratching his middle nails?
So no, they're not only scratching their middle nails. Dogs will learn to kind of curve because they don't want to scratch their pad. So they actually learn to curve their nails over. So they're only scratching the nail part. If they're conformationally not sound, meaning I do have some dogs that, their nails, feet, toes may look like this. You may have to angle the board. I've even done where I've put a half of a PVC pipe in the middle and actually put the sandpaper over top of that to help get a dew claw, because that dew claw sticks out. So you kind of have to modify it a little bit depending on the animal. And they're not going to not scratch their feet because they think their nails are good. That's not something that they have the capability of assessing, so to speak. So it's probably they have not been taught the behavior.
Can dogs learn how to be steady for a chest x-ray that the vet will need to take?
Absolutely. So holding a position is absolutely a behavior. Now, part of the problem with that, now we can get them to lie down on their side and take that side view, but for a chest x-ray, they also have to lie on their back and do what we call a VD view. So they oftentimes have to be in a V-shaped tray to get the perfect positioning for that. You certainly could train that. That is absolutely something that you could train, but I will say it's probably best if your pet isn't comfortable with those, to just sedate them for the procedure itself, so that we can do everything that we need to do and they are sedated and they don't know the difference. But that way we can get perfect positioning, because you also have to stretch those legs back. It's a little bit more complicated than just trained behavior.
Steve wants to know how you can tell when nails need clipping.
So on a white nail, you can see that the quick is really is extended down. So the quick is that blood supply. But really nails shouldn't be touching the ground. So they shouldn't curl over and touch the surface of the floor. They should just kind of ride just barely above it. And so if they're touching the ground or you're hearing nails, scurrying across the wood floors, they're too long.
Samantha wants to know, how do you determine when a dog's anxiety needs medication? Is there something specific to look out for?
Yeah, so if you can train through an anxiety producing situation, like let's say the dog is scared of cars, but you're able to get the animal at a distance away, that they are not reacting, that they're not scared, they're taking food, and then slowly work them up towards that closer and closer stimulus, then it probably doesn't need something like medication intervention. But if there is no distance that you're able to train in, or the animal's reaction is so intense and then they stay highly aroused post-reaction for a prolonged period of time, that's where medication can play a role. It's going to decrease the intensity of a behavior because of it's decreasing the intensity of that fear and anxiety that's driving it, as well as better the animal's ability to recover when they are triggered. So if training isn't working and you feel like you're spinning your wheels, then maybe medication is going to play a role. The other thing is, how much of their day do they spend anxious? So if it's over 50% of their day they spend in an anxious state, we should be using medication for quality of life purposes. So every animal is going to be very different, but it's definitely something that you should talk to a trainer, a qualified positive reinforcement based trainer about, or your veterinarian or a veterinary behaviorist.
Is it okay to soften kibble if the dog is teething? They're noticing he is having bad breath and they're not sure if it's connected.
Yeah, I'm assuming that this is a puppy. So yes, you can soften kibble. A lot of times that bad puppy breath is actually because they are teething and there's a lot of gum inflammation and bleeding that's happening. So kind of has an iron-like smell to it to me, but that's not uncommon. But if you're concerned, you should ask your veterinarian to take a look at those teeth, make sure there isn't one that's cracked or there's food caught or something like that.
How do you deal with an extremely fearful dog when they need grooming, and because of COVID, you cannot be there with them, and it would take too long to train them before they are actually comfortable with grooming?
Yeah, that's where medication really needs to play a role. So making sure that experience can be as comfortable as possible using a situational anti-anxiety medication. Because if you don't have time to train it, you can't be there again because of COVID. That we need to make that animal as comfortable as possible and not push them over threshold.
And she said that her dog is already on buspirone.
So that's a daily medication. And so maybe an event-based medication. So you might want to talk to your veterinarian.
Okay. Oh, she's also tried to use trazodone.
There are about 20 different event medications out there. So definitely, and if it's something that your veterinarian isn't comfortable with, that is sort of the extent of their behavior medication knowledge, which is not uncommon, then that's when you need to go seek care from a veterinary behaviorist.
And I think we've hit the end of the questions.
All right. That was a lot.
Yeah.
Questions, guys.
We will send you the chat so you can see the comments that different people made direct toward you.
Thank you.
Mostly, thank you. And this has been excellent.
Good.
And thank you.
Thank you. Thanks to your dog's friend. Have a good day, you guys.
Bye.
Bye.